my pleasant task to present on achieving the outcomes of the community and evidence-based practice modules in the undergrad medical curriculum using online assessment on behalf of my fellow colleagues whose names are listed on the slide, Dr. Mahomed and Professor Andrew Ross. The community and evidence-based practice is a flagship program of the undergraduate medical curriculum. This program was highlighted as one of the best practices by the Health Professional Council during the accreditation visits to the medical school. The community and evidence-based practice module is a spiral module that builds on what was taught in the previous year and is based on a community-oriented primary care cycle. In this cycle, it has been explained and has been demonstrated. The starting point is a baseline analysis and a community diagnosis, which results in a prioritization of problems that then requires a research question or the detailed problem and assessment, a root cause analysis, followed by an intervention plan, implementation, and evaluation. So in the 3 years, in selective 1, the students do the first part of undertaking the baseline analysis and developing a prioritization of the problem. In the second year, they develop a protocol, answer a research question by conducting a research project. And in the third year, you actually have the intervention planning. To break this down further, community and evidence-based practice 1, which is done in year 2, is built on the scaffolding of what the students do in the Becoming a Professional module as part of the Making a Difference, where they're exposed to a certain community to do certain actions. But in community and evidence-based practice 1, we move the students away to physically interact with patients at the primary healthcare level. The time that's allocated normally for selective is the 2 weeks prior to the mid-year vacation, and the students are not given additional resources. They actually go out to their own places of residence, where they interact with a general practitioner and or primary healthcare facilities, as well as the community in terms of the patient itself. So prior to COVID, what used to happen is that the students would select one general practice and maybe 2 primary healthcare facilities, or 2 general practices and 2 primary healthcare facilities, because the students work in groups. And they would observe 100 consultations amongst the group members. They would then enter this data into an Excel sheet, look at prioritizing the condition and identify which condition occurs more frequently, and through that, in a mini way, prepare a community diagnosis. And once the community diagnosis is prepared, the students would then take this, whatever priority condition they've identified, and ask a research question. And this question will be based on the biopsychosocial rather than only the medical aspect. So we will look at the determinants of health. And once the research question is developed, the students will then conduct the literature review on that specific research question. Simultaneously, to bridge the gap and to get the students to be oriented to what actually happens on the ground, each student is required to identify a patient with a chronic health condition and become a buddy to that patient and actually conduct home visits over the next 3 years, where they would look at the determinants of health and how it affects the patient and how the patient lives with that condition. In 2020 and 2021, because certain aspects of this could not have been completed and access to facilities was limited, we had to think on our feet and change these assignments while wanting to ensure that the students achieve the learning outcome. So the Health Systems Trust on an annual basis prepares the District Health Barometer, which is an analysis of the data that is collected through the District Health Information System. And in this way, they prepare profiles, population profiles, and disease burden profiles for each district in South Africa. What we did was we then asked students to look at a specific district from where they come from and analyze the data, look at this data, identify what is the burden of disease, and from this convert the indicators into a priority health condition and complete the research question and literature review. Because family visits were not allowed, we provided the students with a case study of a chronic patient with all the determinants of health listed in and asked the student to analyze this. So in this way, we actually assess the students' learning outcomes and used an online where students submitted their assignments in Moodle and together with a presentation. Once the students moved over into year 3, which is community and evidence-based practice 2, normally what used to happen is that the students would develop a research protocol that would follow the same processes from the biomedical ethical research committee that's required for everyone doing research. They would then collect the data once full ethical approval was obtained during their mid-year vacation, 2 weeks prior to the mid-year vacation, and they would conduct interview-based questionnaires amongst 100 patients or members of the community. They would collect the data, enter the data into a Microsoft Excel database, analyze the data, develop a poster presentation similar to what's been presented in conferences, and they would also conduct a follow-up visit for their patients. And in third year, we would ask them to identify an acute patient that presents with a minor illness at a facility, analyze the case, and identify or answer 3 questions from a population perspective. Because the entire research process was not possible in 2020 and 2021, we provided the students with a research case example of a protocol, and where information was uplifted or information was incorrect, and we asked them to critique a research protocol. We provided them data around immunization coverage from the KwaZulu-Natal Department of Health, and we asked them to calculate these immunization coverage indices, interpret it, and provide us possible explanation. And in this way, we stimulated a discussion around analysis of data. In terms of the chronic patient, there was no follow-up case, but we provided them with a case study of a patient presenting with an acute medical condition. So in this way, we were able to achieve or assess the learning outcomes that were required from this portion of the module. When students enter the 4th year, whilst simultaneously conducting family medicine-related assignments, the intervention arising from the research is implemented in the 4th year, and where students are expected to do a health promotion intervention based on the research findings, evaluate that intervention and present what they've done. And there is always a follow-up patient visit. Unfortunately, this was not possible in 2021. So we asked the students to come up with a proposal of an intervention on what they would have likely found. And in that way, to get them to think around the health promotion principles. And we also requested them to develop and utilize a comprehensive wellness plan and follow up their patient on WhatsApp to see how COVID-19 has impacted on the management of their chronic condition. Understanding that our students live in the 4th industrial revolution and are very innovative in the way that they do things, we had students developing WhatsApp and different infographics that were used to assist their patients in terms of providing with information and answering their questions. And in that way, we could see that the students were achieving their learning outcome. In 2021, we took a slightly different focus on the health promotion activity, where we asked the students to develop an educational video on the prevention of COVID-19 in the context of a chronic condition. And here, the focus was on vaccination because we know that there's been lots of myths and discrepancies around people or hesitancy to actually take the vaccine. And this showcased the students' skills in advocacy and communication, and also how afraid they are with using technology. As is demonstrated by this slide, you will see that this is what one of the student groups actually presented. This is a snapshot. It's a very brief so in this way, we could see that we use the various changes that were required to actually fulfill the requirement of the learning assessment, and we achieved the spiral learning that we require of our students. Thank you very much.